I'm Dr. Sean Phelan. I'm here today from Wake Forest Chiropractic to talk with you about disc herniations and about sciatica, which is a condition that can be caused by disc herniations. We treat this all the time in our office, but let's get a little bit of an idea of what they are before we talk about treating them. Very simple diagrams here that describe the structures, and if we look at this in simple terms, vertebrae are really not much more than a couple of blocks of bone stacked upon each other, which is what creates our spinal column. And the vertebrae are separated by discs, intervertebral discs, whose job it is to absorb shock and provide us with stability. Behind the vertebrae and behind the discs is the spinal cord, which runs from the brain basically down to the upper to mid-lumbar spine area. Just in front of the spinal cord and right next to the intervertebral disc is the spinal nerve, and the spinal nerve leaves the spinal cord and then heads down into say the arms or the legs in order to supply the lower or the upper extremity with nerve supply and the ability to contract and control musculature and activity. Now the spinal nerves do come in very close proximity to the intervertebral disc. And on this little diagram over here, again, very simple diagram, we see what it would look like if we were to look directly down on top of the spine and the spinal cord and the disc itself. What we would see is bone. This little projection of bone in the back there is the spinous process, and that's the bone that we feel if we push onto the back of our spines. We'll feel this little projection there. Just in front of that is the spinal cord itself, which you see here transiting from north to south. There's the spinal cord if we're looking directly down on top of it, say through one of the lumbar vertebrae. The spinal nerves exit just again posteriorly to the spinal intervertebral disc, and that's where the trouble can start if we have a disc herniation. So this black fibrous looking material there is the disc itself. Inside that, there is a mucoprotein jelly called the nucleus pulposus, and again, that material that you can see right there in purple is designed to further the ability of that disc to absorb shock. Now, what can occur is the disc itself, the fibrocartilaginous material, can become weakened and start to bulge backwards toward or even into the nerve root area, and that's called your disc bulge. That's a disc bulge. That's what you hear about when someone speaks to you about they have a bulge in their back or they have a disc bulge. Now, the disc bulge itself is present probably in about 30% of the population. Walking around on the streets out there right now, they have done studies where they've taken 100 people that have no back pain at all and put them into MRI tubes, done an MRI on them, and it turns out that 30% of those asymptomatic, or 30% of those people without any pain at all, have large disc bulges or disc herniations in their spines, and they've never had pain. So if you do have sciatica, if you do have a disc herniation, the difference between them and you right now is simply inflammation. And that inflammation is what is driving your pain. If we look at the structures themselves, it'll live as a disc bulge for quite a long time, causing some low-grade back pain that comes and goes, gets better, gets worse. Each time it comes back a little sooner, and each time it comes back a little bit worse. This is classic for the development of a disc problem in your spine. Now, what can eventually happen if that goes on long enough, if that inflammation that we spoke of continues beyond a certain point, what will occur is you will start to get some radial tearing in the disc material or the fibrocartilage itself, and the nuclear matter starts to bulge outward, and that is when we start to consider it a disc herniation, where the material is starting to herniate outward. In some instances, what will happen is the outer material of the disc itself will actually tear through and rupture, and that jelly can leak outward, or even pieces of the disc itself can break off and then start to transit up and down the spinal cord area, floating around, causing all kinds of trouble. And that is what we term the disc rupture. So we kind of have three terms: the initial bulging, the herniation, and then finally the rupture of the material. How do you know if you're suffering from something that's disc related, or it's related to muscle pain, or it's related to nerve root issues? Well, if you have a disc problem, you're probably going to have a sharp, linear, or line-like pain that radiates down the back of the leg into the calf, or down the arm into the hand area, or even into the shoulder blade area. And that's one of the ways that you know that you're having a problem there. Again, it's probably pain that's come and gone for a long time. And the longer it's there, the worse it gets, and it keeps happening a little sooner and a little sooner. The bottom line when we get into this situation is that the disc is inflamed. Now, you feel like it's a muscle problem on top of that, and that's normal because the muscles actually contract and splint, if you will, to protect the body. The muscles may actually pull you into antalgic postures where you'll be pulled to one side or the other as well. So one of the things you need to understand is just because you're stiff and immobile and you have a muscle spasm, it does not necessarily mean that this is a muscle problem. The muscle spasm may be the result of the disc herniation itself and your body's attempt to protect you from it. If the person has these conditions, what's going to happen typically, if there's no change and there's worsening in the condition, if there's progressive pain, if there's progressive neurologic deficit, we're losing motor control, the end result may be a surgery. Spinal surgery, either neck or low back. Now, if the person is pre-surgical and is trying to avoid that surgery, or is just concerned that this is a condition that may be developing, in our office we basically have 3 goals when that person comes in to see us. Number 1, we need to stop the pain. We need to get them functional so they can continue with their life and get back to work and whatever it is they need to be doing. The second thing is we need to restore the function of the spine so that they're able to move and the structures are not creating pressure on the nerves. And then the last goal that we have in the office is to take the person and strengthen the spine, strengthen the musculature, so that we don't wind up with a chronic situation and have to redo this condition or redo the treatment over and over as time goes on. I've been treating disc herniation since 1992, and we typically will use manual therapy, we'll use rehabilitation, we'll use ergonomic training, home care. All of these things come together in order to get the person better. We'll also refer out to physical therapists, we'll refer to massage therapists, we'll refer out to general practitioners or to orthopedic specialists if we need them to help us along with your care. The goal again is to get the pain under control, to restore the function, to strengthen the spine, help you avoid a surgery if at all possible, and train you how not to injure the disc again as time goes on. Okay, once it is better, once the function's restored and it's strong and you're back to work and you're not having pain, what happened with the disc material? What's going on there? Well, the same thing that has happened or hasn't happened to the person in the street that's had inflammation and a disc herniation in their spine and has had no pain. What you're looking for there generally is for the inflammation to die down and for the pressure to come off the nerve. Once that happens, the person can still function with a disc bulge or a disc herniation in the spine, and as the swelling goes down, the bulge may still be there to one extent or another. Even some of the migration of the nuclear matter may be there to some extent or another, but it's no longer impacting the spinal nerve. And the good news about getting older, one of the few things that's good about getting older, is that the discs will tend to dehydrate and toughen up somewhat as time goes on. So even if you've had a disc herniation, even if you've come close to surgery, even if you've had to undergo care for this, does not necessarily mean that at some point you're going to go through surgery or you have a, quote, bad back. It just means that you need to get the discs to a point where the inflammation is under control and they can toughen up naturally as the years go on, and so you can do all of your activities without fear of further injury. Please visit our website, and if you'd like to see some more information on that, or contact our office, and we'd be happy to consult with you. Thank you.